Okay, wonderful. Well, welcome this lovely Wednesday morning to the FAAST Board and ATAC orientation. This is my second time doing this presentation, so please bear with me. Our goal is to supplement a lot of what is in the packets that were sent to all of you. It's a ton of information. If you've ever served on a board or advisory council, you'll be familiar with our processes. So this morning, my goal is to just kind of highlight the ways in which we're different and how FAAST operates. We're not going to go into a ton of detail on everything. So if you have questions towards the end, please just let me know and I will be happy to answer them. So this morning, we're going to start. We're not going to call for quorum because we're not going to be voting on anything. But I do see we have a few members on the line and we are going to go ahead and get started. So FAAST, the Florida Alliance for Assistive Services and Technology. We're a 501c3 nonprofit here in Florida. We were established back in 1994 through RSA, which we're now under the HHS through the feds. We are formed from the Assistive Technology Act, which was updated in 2004. We also receive some of our funding through the statute that was created in Florida through the General Revenue Funds in Florida. Those two statutes, there are electronic copies in the packet for review. You don't have to memorize them, but of course, if it ever comes up in a meeting where we start discussing statutes, you'll have those resources available to you. We do contracts with the Division of Vocational Rehabilitation, which is how our federal and state money is given to us. And our mission is to improve the quality of life for all Floridians with disabilities through advocacy and awareness activities that increase access to and acquisition of assistive services and technology. I don't have a definition of what assistive technology is in this slideshow, but I will say on our website, we define it as basically anything that assists someone to live the quality of life or the independent life that they choose. So it can be really high tech, like fancy softwares and iPads and eye gaze systems where your eyes control all sorts of software, or it could be something really simple like a pair of colorblind glasses or a magnifier. So these are our FAAST core services. We do have more information on the website, on our website about them, which is why the link is provided. I'm just going to kind of briefly go through each of them so you can get an idea. Some of these services we do at our headquarters in Tallahassee, which is the staff that you all work with on the board, but we also subcontract with 11 different nonprofits across the state of Florida to help us distribute our services and to reach more Floridians who have disabilities. So I'll also specify if we do that at state headquarters or if we do it through our subcontractors. So our assistive technology, which you'll notice we call it AT, so if you hear us say AT, that's what we're talking about, our device loan program. So this is where we do short-term loans. They're usually about 35 days, where someone can ask for a piece of tech that we either have here at state headquarters or our regional demonstration centers, which is one grouping of our subcontractors. They can loan devices as well. So this is for someone who wants to try a piece of equipment, but they're not really sure if it will be the most beneficial to them, if they'll really like it. So they can borrow it from us for 35 days to see if it works for them. They can borrow multiple devices. They don't just have to borrow one. They can keep throughout the year borrowing different devices to try to figure out what will work best for them. We don't have any sort of maximum on how many times someone can use our device loan program. So that's been a really great service that we do all across the state of Florida. And in our office, Hannah Brock is the person who oversees that program. So if you have any more questions about that, I can put you in touch with her. Our assistive technology device reutilization, refurbishing, and recycling program. This is part of our reuse program is what we call it. So this and the device exchange, they are subcontracted through our regional reuse centers. So we have our regional demonstration centers, which we lovingly call our RDCs. And then we have our reuse centers, which we call our RCs. So regional reuse centers. So the reutilization, refurbishment, and recycling program, what it does is if people have assistive technology, typically it's durable medical equipment, which we categorize as AT as well. They can give it to us or give it to one of our regional reuse centers, and we can fix it up, clean it up, whatever it needs to get it back out into the community. So our goal is that, you know, if people have an old wheelchair from a family member who's passed away, or they were temporarily injured, or maybe they upgraded their tech and they have an old iPad that they don't need anymore. This is to get more technology back into the hands of Floridians and not sitting in closets or in drawers and that sort of thing. The next item is the device exchange program. So this is again with the regional reuse centers, our RRCs. This is also hosted on our website. We have a whole area, kind of like a classifieds list. I believe we call it the AT list on our website, where anyone in Florida can go on there and post a device that they have. They can offer it for sale or they can just give it away. But the idea is that FAAST is not so much involved in those transactions. We're more so give people a platform to post the information, and then they can connect with others via contact through that website platform to sell their devices or exchange their devices, whatever they need. So just another way that we can get more technology out into the hands of Floridians. The AT skills development and transition trainings. So we do quite a few different kinds of trainings. We do them here at state headquarters, and also our DCs, our demonstration centers, do them as well. Our goal is to help train people on the different assistive technology items, trying to let people know how exactly to use them. It's actually part of the process of getting up to purchasing their own devices. Sometimes we do trainings on like funding, how can you get funding for your AT, or where can you find AT, all sorts of that. We do focus a little bit on transition. The Assistive Technology Act specifically says that we have to spend 5% of one of our chunks of money on transition specifically. So this can be students transitioning from high school to college, or out of college into the workforce, or from a assisted living facility back to their home. Any sort of transition, we can help with that to try to make sure that they have the right tech that they need to support themselves. Our AT device demonstrations. This is kind of exactly how it sounds. This is demonstrating different devices. Typically, it's a comparison. If we have two different tablets, or if we have two different apps that can help do the same thing, we can demonstrate, you know, which one does which and try to see which is better for the user. So this is something that we mostly do with our RDCs. We don't do this a whole lot at our headquarters just because we don't have a lot of foot traffic of people coming in. This is, of course, pre-COVID. This can be done electronically, of course, through like a webinar platform, but we just haven't done that much of it at headquarters. So most of our demonstrations are out in the field with our subcontractors. Our AT information and assistance. This is something that we really focus on at headquarters, but our regional demonstration centers do this as well. This is if anyone in the state of Florida, you don't necessarily have to be a person with a disability if you're a family member or if you're a professional working with people. If you have a question on any sort of tech, our hope is that you'll call us and we will try to connect you with the best resources that we have either available to us, or we will send you to one of our organizations that we work closely with. A lot of these calls are, you know, how can we get AT, or I don't even know about this device, how can I get connected? So we do that here at headquarters through Tim McCann. So if you see his name, he is our INA specialist, as we say. And he actually has a certification in information and referrals, I believe. So he is very knowledgeable. So if you ever have any questions related to AT, he's your go-to guy. It's often where I send a lot of people when I get those random calls when people get lost in our phone tree. So Tim is really great and he's very helpful. The AT technical assistance, this is something that we do at headquarters, but our regional demonstration centers do this as well. This is if any other organization or agency, or it could be anybody, if they're working with a group of people, need technical assistance in regards to AT. Maybe they're trying to make sure their students are receiving the correct information in regards to assistive technology. We don't do probably as much technical assistance as we should, just because it's a little bit challenging to find all of those instances where we can help people, but we do the best that we can. So if there's ever anything within your agencies or other nonprofits that you work with that have questions on how they can get more technology or more information to people, please let us know and we can lend our expertise as best we can. And then our New Horizon Loan Program, you'll hear it called NHLP, which is funny because we call it NHLP program, so the P is a little bit redundant, but it is what it is. So our New Horizon Loan Program is our state financing program. This is where individuals who have disabilities can reach out to us and get a financial loan. It usually has a pretty low interest rate. I think as high as we go is like 5.5 or 6%. That's something that Eric Reed, our deputy director, he oversees this program. He has a background in banking, so he's excellent for the position and does a really great job. This program is funded through our investments that we received back, we believe in the early 2000s, from the feds that funds this program. So what it does is, you'll see later on, we have 2 investment accounts that we use. We pull that money down to help fund loans, but then people are paying us back and we're gaining interest on those loans. So each year, Eric is giving out more and more loans. So our hope is that program eventually grows to where we don't need the investments, but we're getting all of the funding for that program off of the investments. Or I'm sorry, off of the interest. So that was a crash course. You'll hear more about these core services as you get more familiar with FAAST. We're constantly talking about them and focusing on them. Our FAAST funding structure. So one of our biggest pot of money comes from the feds through HHS. It's through the Assistive Technology Act. We are one of 56 programs across the country, but I believe we're one of, I think it's either 7 or 14 who are nonprofit based and don't go through like their state VR or the DD Council or Centers for Independent Living specifically. We are our own nonprofit, so there aren't a whole lot of us in the 56 programs that are doing it that way, but we do have resources and there is a national network. We also have a national center who helps us with technical assistance, which is called AT3. I couldn't tell you what it stands for. I always have a hard time Googling it, but their acronym is actually AT. So they just call themselves AT3. We also go through the Administration for Community Living, so through ACL federally. So if you're familiar with that group, that's actually who oversees our contracts. So currently through our federal contract that we go through VR, we receive $700,881. We receive this quarterly. It's a reimbursement, so we spend the money and then submit the invoice to VR to be reimbursed. This is a contract that we're renewing every 3 years, and we're hoping to go to an annual contract so that we can be sure that we're serving our clients as best that we can and changing with the needs as needs change if they do. Our second biggest pot of money comes from the Florida General Revenue Fund, which is through the Florida legislature. That amount is $444,415. That was historically advocated on through one of our committees and some of our other state partners. So we're really grateful to have those funds, and both of them fund our regional demonstration centers and our regional reuse centers. So when we talk about all of the different things that we do through the Assistive Technology Act, all of that is funded through these 2 pots of money. So annually that ends up being $1,145,296. So for our NHLP program, which we just touched on, there's two chunks or two programs within that, I guess is maybe a better way to say that. The Alternative Finance Program, which you may hear called AFP, and then the Telework Program. So these are just two different ways that people can receive funding. My best understanding is telework is to help people open their own business or do something more in the realms of work, versus alternative finance could just be they want to buy a piece of assistive technology and they don't have funding for it. So if someone were to buy, let's say, a vehicle with a lift on it, depending on what the purpose of that vehicle is, it could be through the AFP funding program or it could be through telework. So that is one of our federal requirements, that we have this program, or I should say it's an option to have it and we choose to have it because it's a very successful program for us. And this is run, as I mentioned, off of 2 investment accounts. We have a total of 3 investment accounts where we've put our money. One of them is for the AFP funding and a second one is for the telework funding. And then the third is for our board reserve operating account, which we'll touch on, I believe, in the next slide. So at the end of April, the NHLP total assets in those investments accounts were $2,068,685.38. They did take a hit, as you can imagine, this year with all of the pandemic stuff. So we are trying our hardest not to pull down money from those accounts so we can try to let them rebound a little bit. We do have 2 grants right now. One is through the University of Miami. We call it the Step Up Grant. It's in year 4 out of 5. So next fiscal year is the final year of that grant, but we're already in talks with the University of Miami to try to extend it. They actually received the funding from, I believe it's the Federal Department of Education. They applied for a grant and then we're one of their subcontractors with giving the grant out. And this grant mostly focuses in the Miami area, working with public schools to try to get more AT in the classrooms and try to increase the reading scores of students who have disabilities. Currently, we used to subcontract out again to help us with this grant, but we recently brought it in-house. Next year will be even more in-house because the demands for the grant as we get to the end of the 5 years has decreased, mostly because it's a program up and running and we're doing just supportive type stuff instead of building it. The second grant that we have is through the Craig H. Nielsen Foundation. We call this the Nielsen Grant internally. It was a 1-year award for $50,000. This is something one of our board members, Paul Tobin, who's our treasurer secretary, he sits on one of the, I believe it's the board, it might be a committee for the Craig H. Nielsen Foundation. So he was the one that turned us on to this funding opportunity. He's told us many a times, if we knock this out of the park, the next funding amount for Craig H. Nielsen is, I believe, $350,000. So we are doing our best to make sure that we do this grant properly. What we proposed in this grant was to do smart home assistance type stuff. So we've partnered with an organization that I believe is called Smart Home Assistance. I think they're out of Tampa. Matt Holloway, our director of operations, he oversees this grant. He also oversees the Step Up grant internally. So if you have any questions about these two, he's your guy. But for the Craig H. Nielsen, what we're doing is we're trying to get 8 people who have spinal cord injuries, because that is the focus of the Craig H. Nielsen Foundation, is to serve people who have spinal cord injuries. Our goal is to get them set up with all sorts of home tech equipment so they can have smarter houses, in hopes that they can reduce the amount that they need their personal care assistance. So our thought is, if we can reduce the need for the personal care assistance, which might in turn alleviate need for state or federal supports for these individuals, that we can reduce taxpayer dollars on these individuals by giving them this sort of tax. So that's what we're hoping to prove with these 8 people. Of course, we're not doing any sort of research, but that is the goal of our grant, is to reduce the amount of time that they're using their personal care assistants. So our board designated reserve account, which I mentioned, this was just created in 2019. It's made up of our unrestricted monies, so that's why it's in a separate investment account and a separate bank account. The bank account just has $30,000 in it, and we mostly use that in case we're having any cash flow shortfalls and we need to move some money over quickly to cover payroll. This typically happens at the end of the quarter when we're waiting on our invoices from both rehab. Things take time, so sometimes just the timing of things gets a little thin, so we do occasionally, a couple times a year maybe, have to move money over. But then in the investment account, which is what this dollar amount here is of April 30, it has $342,510.50. The goal for this was to be sure if something terrible were to happen or we were to lose funding, we would have hopefully enough money to cover 1 quarter of expenses without making any changes. Of course, if we were to make changes to some of the money that we subcontract out, we could last a little bit longer, but it was the board's hope that in case anything terrible happened, we would have funding to continue. So that's why we shot for just shy of 400,000, since that's about 1 quarter of our invoices from both the federal contract and state contract. I did recently do a financial statement orientation video at the beginning of this fiscal year, which FAAST follows the federal fiscal year, October to September. This is a link here. It should be in the PDF of this slideshow that you can go and listen to me talk for an hour on our financial statements. If you have any interest in that, I definitely encourage you to go check that out. It goes into our budgeting process and a little bit more of how we break up what we do through our state level activities and state leadership activities. Those are just terms that the ATAC uses to break up the device loans, device demos, trainings, and information and assistance. Their goal is to have us spending 60% of the federal money on the device demos and device loans, and only 30% on the trainings and INA. 40%. So with those, that's what helps us focus in on our budget, which we are starting to look at our budget for next fiscal year. We probably will start discussing it at the June board meeting. However, it will probably be approved at the August board meeting. Does anyone have any questions on all of the fun stuff we've covered up until this slide? I know I've been kind of talking quickly, but I know we have a lot of information to cover in just an hour. Okay, hearing none, I'm going to continue. If you do have a question, just jump right in and let me know. This is our Florida statute number 413407. You do have a PDF copy of the statute in your orientation packet, and it's also importable under the orientation packet. And there's a PDF copy of the Assistive Technology Act of 2004. So as you read the AT Act, you can kind of get an idea of all of the things that are supposed to be happening here in Florida for AT. And then it outlines broadly the Assistive Technology Advisory Councils. And then the Assistive Technology Advisory Councils, known as ATAC, is what's explicitly written into the Florida statute. So that tells us a little bit more about how our council is supposed to be made, and how many people are supposed to be on it, and what the roles of the council are. Our contractual obligations. So as I mentioned, we have 2 contracts with VR. One is for our HHS funds that comes through ACL, and the other is for our general revenue funds. Each of these 2 contracts supports 3 of our regional demonstration centers. So we have 6 regional demonstration centers total. I'm not quite sure how each got on which contract, but For now, they're evenly split between the two. And then what we call internally is our HHS contract, which is our federal funds. It supports all 5 of our regional reuse centers. Some of that funding for the reuse program also is kept at headquarters so that we can supplement our 5 centers as needed. But these are the people that are doing all of that device exchange and refurbishment. It just so happens that these 5 regional centers are all centers for independent living. They have device loan closets that they're using to get tech back out into the community. So our funding is just to supplement what they're doing, just to help them to get more out in the community. So those contracts are only $10,000 each. It's not a ton of money, but our hopes is that it'll help repair some devices and get stuff back out. The regional demonstration center contracts, these are $90,000 contracts for each of the 6 centers. Currently, one is the Pensacola Center for Independent Living. The other here in Tallahassee, which is actually right next door to FAAST, is the Family Cafe. In Jacksonville, we have Hope Haven, which is I believe it's a school for children who have disabilities. I don't know exactly what all they do. The University of Central Florida and the University of Miami are also demonstration centers. And then Tampa General Rehab Hospital is a regional demonstration center. So those are the 6 that we have. And then, like I said, the reuse centers are all centers for independent living across the state of Florida, or 5 of the centers for independent living across Florida. And then for our grant awards, we do, of course, have contracts with University of Miami and Craig H. Nielsen Foundation for those 2 grants. Our policies and procedures, the documents that you have in the orientation packet is a copy of our draft procedures. We are currently updating those. We just reviewed the employee manual and the accounting manual and sent those over to our friends at VR to help us review those. Whenever we do get them back, they will go to the FAAST board to be approved and implemented. We ended up having so many copies of these draft policies that we weren't actually sure what was current and what was old. We actually had a hard time finding something that said that it was current. So in order to remedy that, we're reviewing the policies just to go ahead and do a clean slate and get us back to where we should be. So what you have is probably an old copy of the drafts. So as soon as we have the new employee manual or handbook and then the accounting procedures, we will get that back out to the board to be reviewed and approved. A copy of the bylaws, I think we talk about that later, but just in case, there's copies of the bylaws in the packet as well. Okay, so here is the really fun stuff, all of the committees that we have. So after this meeting, I will send you each an email asking you which committees you'd like to serve on. I will preface by saying, since you represent state agencies, you're automatically on the Interagency Committee. This is one of the 3 committees that are written into our Florida statute. So the Interagency, the Technology Awareness, and the Public Policy and Advocacy, these 3 are written into the state statute. So we must have them. What we ended up doing is combining the Interagency and Public Policy and Advocacy Committee, because we felt that it was basically 2 different groups of people, but they were doing essentially the same thing. I believe it was combined a few years ago. It was a little bit before my time. So I'm the staff liaison for that group. So I try my best to understand how we're doing things, but we will go into more detail on those committees. The Technology Awareness Committee, as I said, is also written into statute. But then the New Horizon Loan Program Committee and the Service Delivery Committee, these aren't explicitly written into statute, but they're committees that we created. NHLP, of course, oversees that financial loan program, and Service Delivery oversees how we're delivering our services to Floridians. We will break down each of these in the next couple of slides, so we will go into more detail. Our board of directors, it is a little bit confusing because these are technically 2 different two different bodies, even though they're made of the same people. So our ATAC, as written in statute, kind of oversees all of our AT programs, but then our board of directors directly oversees the nonprofit organization. So for the board of directors, we have the executive committee, and then that committee actually created two ad hoc committees, which is currently the strategic planning ad hoc committee, which that's the group that is overseeing our 2020 strategic plan, and that has invited everyone to join us next week for our strategic planning meetings. And then the second is that search ad hoc committee that was discussed on our last board call to hire the new executive director. So you've already been asked at least about the search committee if you want to join that, but if you have any interest in joining the strategic planning committee as well, that's also available to you. Our hope is that that committee will only be needed through the end of the fiscal year. And then once the plan is up and running, the oversight of the plan will probably be absorbed in the executive committee. So the Public Policy and Interagency Committee, we also call it PPAIC. This is the definitions of the two different committees, so you can kind of see how they're relatively similar. The Public Policy and Advocacy Committee is to review federal and state legislation and agency policies and practices, and to identify facilitators of and barriers to access and utilization of AT services, devices, and funding sources. But then the Interagency Committee is composed of those members representing state agencies. They shall work towards the development of cooperative agreements among government agencies and perform such other duties as the council deems appropriate. The Interagency Committee's members shall assign staff from their respective agencies to the Alliance as an in-kind contribution for a specified period of time to review federal and state legislation and agency policies and practices, and to identify both facilitators of and barriers to accessibility and utilization of AT services, devices, and funding sources. So for the most part, the PPAIC committee reviews our legislative priorities whenever we create them. They also interact with our lobbyists if we decide to have a contract lobbyist, and they are the people that oversee if we do like a legislative workday where we bring ATAC members up to the Capitol to discuss different AT needs across the state. Last year, we didn't really feel that we had any legislative priorities, so we did not have a legislative agenda. However, the year before we have had them, I think actually maybe the last couple of years. I think this was mostly due to not having an active executive director at the time of the legislative session, so all of us staff didn't really feel any sort of need to push the board to have legislative priorities, and the PPAIC committee didn't feel that way either. So we didn't have any last year. We did work a little bit with our lobbyists just to get some updates on some other things. We were keeping our eyes out on like the iBudget just in case it impacted any sort of AT needs of those clients. So really, again, we're mostly keeping our eye on assistive technology. So if any legislation comes through that's somehow going to restrict or increase those barriers or utilization or accessibility to AT, that's when this PPAIC committee really jumps in and we do the best that we can. So with the interagency group included, it's really nice just to have a collaborative conversation. One of the topics that we took up last year was about the school concurrence with Medicaid, about how certain students weren't able to get Medicaid to pay for AT because the schools had to agree, but I guess the language is a little bit loose, and this is all not me saying this, this is just what the committee was discussing about who approves those AT purchases through Medicaid. So students were getting turned down because there was confusion on who to go to and why the schools had to concur. Our PPAIC was pretty divided on this because our representatives from DOE didn't really feel that this was an issue that needed to be taken on. And of course, if it was Medicaid related, it would be through ACA. We don't have anyone who represents ACA on the ATAC, so it was kind of just a Will somebody tell us what the need is? So when we reach back out to our regional demonstration centers who had originally told us this was a problem, no one gave us any information when we directly asked them for it. So since we didn't hear anything, we kind of set the issue aside and thought, well, maybe it was only a problem in Orange County and it's not a problem across the state because we weren't hearing it across the state from anyone else. So that's just an example of something that the committee reviewed and discussed, but then decided not to take any action on. So as I mentioned, you will all get added to this PPAIC committee since you're interagency groups. We don't have any of our state reps that offer an in-kind person from their office. I'm not 100% sure what the purpose of that was. Maybe in the day the interagency committee was much more involved, or maybe it was a way that our state reps didn't have to serve on this committee because they could offer someone else to serve. But at this time, all of our state reps themselves serve on this committee. So the next committee is the Technology Awareness Committee. This is served, I believe Matt Holloway is the staff liaison for this one, so he helps oversee the coordination of this committee and does all of the minutes and the agenda, just as I do that for the PPAIC committee. So members of this committee, they appoint the chairperson. This group guides the council's public awareness activities, which this is going out into the public, doing events, making sure that people are aware of FAAST, so they could be exhibits at events or any sort of discussion, like if there's a webinar and FAAST can jump on and say, hey, we're FAAST, here's the services we offer, so that more people are learning about us. So they guide the council's public awareness, coordination, and collaboration activities to review public awareness activities related to AT services and tech. They also provide input on FAAST outreach initiatives and publications. We have an annual FAAST magazine that we put out. I shouldn't say annual, I think it comes out twice a year, that Matt works on. So he's usually asking other people to write articles and such for that. We also have our weekly access newsletter. It doesn't really come out weekly, but it comes out pretty regularly, a couple times a month. And then we also have a legislative access newsletter that talks about legislative things. We send that one out a little bit less because usually it's only when we have legislative things to discuss. This group also works with staff to develop technology awareness projects. So if there's anything coming down the pipeline that this group thinks FAAST needs to be involved with so that more people know about FAAST, this would be the crew to develop that with staff. They also make recommendations to the board regarding matters for which the full board approval is necessary or desirable. So if any of the projects end up getting too big and the full board needs to be involved, it would be worked through committee, but then it would go up to the full board at one of our meetings. So this can be a really fun meeting where you get to be creative and think of all sorts of ways to have people learn about FAAST. We have some of our board members who are out in the community talking to people who are constantly reporting back to us saying, you know, I keep talking to people, nobody knows who FAAST is. So that is one of our reasons why we did our current strategic plan process, in hopes that we can try to alleviate that a little bit more and have more people know about our services and what we offer. The NHLP committee, so members of this committee appoint their chairperson. The chairperson of this committee actually serves on the executive committee of the board. So by being the chairperson of NHLP, you automatically get a seat on the executive committee. So the treasurer secretary serves on this committee, and the function of the New Horizon Loan Committee is to oversee and review activities of the FAAST NHLP program in accordance with federal and state requirements. This committee reviews and reports on financial and program activities, and they make recommendations to improve policies and procedures and make loan approval decisions. So typically this committee, whenever ERIC gets in new funding requests, this committee has to vote to approve these loan fundings. For the most part, I believe they have to be unanimous amongst all committee members in order for their loan to be funded. But don't quote me on that. It's been a while since I've been on one of their meetings. They also are making sure that all of the policies and procedures with this program are up to date and applicable. The NHLP program does have a manual as well. So once we get these two other policy manuals approved, the NHLP manual will be one of the next ones that we take a look at. The Service Delivery Committee, so this is the other one that isn't written in statute. This is over, the staff liaison for this committee is Hannah Brock. The NHLP one was Eric Reed. So for the Service Delivery Committee, they direct the organization's ability to meet the deliverables detailed in the 2 contracts with VR. They assist staff with the creation of any new VR contract deliverables, and they discuss the model of the service delivery plan to best meet the needs of these deliverables in the contract. They analyze and study the current service delivery model and determine if FAAST is making the best use of resources, abilities, and knowledge to meet the needs of Floridians with disabilities. And they determine an approach to meet the needs of any areas of the state or demographics that are currently not being met. This group actually did a lot of work in the past year, since we knew we were coming to the end of our 3-year contract with VR, about what we need to do for the next round of contracts. We actually proposed totally revamping our service delivery model, possibly subcontracting with more nonprofits to reach more areas of Florida. Typically, the cities where we currently have those subcontracts, that's where the most part are where the people we serve are. So we don't have a lot of rural people served through FAAST, which we know that's something that we need to get better with. The Service Delivery Committee proposed 3 different service delivery models that went to the full board. However, the full board decided to table it and just try to extend what we're currently doing in the VR contracts for another year. They did not feel like it was the time to revamp the service delivery model. This was also another reason why the strategic planning session was needed. They also thought that without having a executive director in place, that it would be hard to execute all of these new contracts or, you know, end contracts, if that's what ended up needing to happen. So they asked us to just put a pause on that and see what the strategic plan ended up coming up with, so that we could figure out a way to reach those people in rural communities, and making sure that as many people as possible are served by FAAST. So this committee is not currently meeting, since the strategic planning committee is meeting. A lot of these people are the same people that are on the strategic plan ad hoc group. So they are not meeting currently, but they will start back up as soon as our strategic plan is finished. The executive committee, so this is the board of directors committee. They're responsible for handling matters requiring board attention prior to the next scheduled meeting, and such other duties as shall be designated by the full board. They make recommendations to the board regarding matters for which the full board approval is necessary or desirable. This group is made up of the 2 co-chairs, which serve annual terms. Ideally, the co-chairs serve opposing terms. So like if one is they serve 2-year terms, but it's each year one should be voted on. So we actually voted for them both, Liz Lott and Marshall Lindbergh, in October, because we did not have a co-chair last year. We only had 1 co-chair. So they were both brought in October. However, we will probably have one of them be revoted on this fiscal year when October starts, and then the next one would be voted on in the beginning of fiscal year 2022. Other members of this group are the treasurer secretary, which is Mr. Paul Tobin, the NHLP chair, which is Mr. Ben Welter. There is a state rep that's voted on amongst all of our different state agency groups, which is currently Tom Delilah representing the Florida Independent Living Council. And then there is 2 at-large members, which one of the at-large members comes from our Category 1 group, which are the individuals who are people with disabilities or family members of people with disabilities who use AT. And then the second at-large member is a representative from our Cat 2 group, which is reps from business or representatives from consumer organizations that both have to do with AT. So we weren't able to fill those 2 at-large positions at the beginning of this fiscal year. So with all of the new appointments, we were able to identify the 2 co-chairs are probably going to move ahead with the Category 1 at-large member. However, they are still working on finding someone to volunteer for the Cat 2-3 at-large committee member. This is my slide to talk about the bylaws for the ATAC and the Board of Directors. I believe it was either in fiscal year 2018 or fiscal year 2019, really not that long ago, where we actually separated the 2 bylaws and created a separate bylaws for the ATAC group. The most current version of these were voted on in February of 2020, and they are in the packet and in Boardable. You can read through those and kind of review. They outline a little bit more the difference between the board and the ATAC. We, for a while there, were having 2 totally separate meetings of the board and the ATAC, but we've currently kind of merged them back together and had board business at the beginning of our meeting, since it's typically just reporting out, and then moved into the ATAC portion of the meeting. So I know it's a little bit confusing trying to figure out which body is doing what, but for the most part, we try to treat them the same and not make it too terribly confusing. So if you are confused, I do apologize. Seems like quite a lot of people are, but we are doing the best we can to make it as clear as we can. So those 2 bylaws are in your packet. They're available for you to review and have as a resource as you move forward with your board service. These topics on board responsibility guide, quick parliamentary guide, and overview of sunshine and public record laws. These are all documents that are in that packet. As state agency reps, I know you all are familiar with sunshine law and the public records requests, but there are some resources there in case you want to brush up on it. I also recently emailed out a copy of a PowerPoint presentation regarding sunshine law and public records. This is something that we've asked everybody to review before the June 10th board meeting, just so it can be fresh in everyone's mind. Of course, we do try to follow Robert's Rules of Orders. However, we know that those can be sticky because not everyone knows them to the best of their knowledge. So what we consider parliamentary procedures is what we try to follow. There's a little guide in your packet that talks about those. So if any of you are experts on Robert's Rules, we definitely ask for your feedback when we do board meetings, especially when it comes to voting on representatives to fill the officer seats. That seemed to be a challenge for us last year because we kept getting hung up on our Robert's Rules procedures. Board responsibility guide, that just talks a little bit about what it means to be on a board of directors. So if you've ever served on a board of directors, I believe this document will not tell you anything new and exciting, but if you haven't, please check that out so that you can get a refresher or learn what needs to happen as you sit on the board. The ATAC appointee chart and member directory, this is actually something that was shared on our last board meeting. This is the list that talks about all of the members, what category they represent, what their terms are, and if they're in their first or second term. Members of the ATAC can serve 2 consecutive 3-year terms, but they have to be reappointed for that second year. They can come back and serve more terms, but they have to be off of the ATAC for 1 year following the 2 terms, and then they can reapply to be reappointed to serve a next set of terms. So as long as you take a year off between 2 terms, you could serve on the FAAST board for as long as your organizations wanted you to. For now, we haven't had anyone to my knowledge who's come back after taking that year off. Of course, 6 years is quite a long time to dedicate to an organization, so we appreciate any of the leadership that our board members give us. So this is something that's in your packet as well. I also believe that contact information is supplied for the other board members. Of course, we ask that if you're going to discuss anything that would be a sunshine violation, not to do that. But if there is any sort of simple questionings that you don't believe that staff can answer, our co-chairs are available if needed. The travel authorization and reimbursement procedures. We currently don't have any plans to travel for the board due to the current pandemic. So our meetings will take place via GoToMeeting or GoToTraining. But we do follow the state travel manual. So a copy of that manual is in your packets. I imagine that you all are very familiar with the travel authorization and the requirements from the state, but in case you are not, that's there for you to review. Currently, Megan Germain, our executive assistant, does all of the administrative help for the board travel. So when we are going back to traveling, she'll be the one to reach out to you to get the information to establish your travel off. And then after you travel, she'll be the one reaching out, helping you complete your travel voucher. So that's something we do follow to become familiar with if you aren't already. Thank you all for your time this morning. I really appreciated going over everything with you. Again, if you have any questions, please feel free to reach out to me. I believe you all have my email, but if not, it's wharris@fastinc.org. So thank you for your time, and I will send you an email asking about your committee assignments. So I hope everyone has a wonderful Wednesday.